Hello, my name is David Briones Fajardo. My topic: effect of lower extremity sensory amplitude electrical stimulation on motor recovery and function after stroke. Definition: sensory amplitude electrical stimulation up to the lower extremities is a technique that sends electrical stimuli so that the muscle reacts in different ways when they receive said action. This according to the speed and efficiency with which the body's signals are transmitted through the nerves.
Until recently, there was little motivation to do rehabilitation after stroke. There was really just no scientific basis that gave us hope that we could induce some type of recovery in the brain after a stroke occurred. And then a few years ago, scientists looking at other animals discovered something which to us was, quite remarkable, which is that new brain cells actually can grow in damaged areas, something called neurogenesis. It was something that none of us thought ever happened in the brain, and when that was discovered, all of a sudden there was this tremendous amount of activity in rehabilitation because we said, oh my God, if new brain cells can grow, let's figure out, how to stimulate that and get people to recover. So there were two approaches. One was to directly stimulate the brain on the surface with either magnetic stimulation or electrical stimulation. And that was one approach which seemed to stimulate the growth of new connections, new brain cells. And the other was to stimulate what we call the end organ, the periphery. So if your hand is paralyzed and you passively stimulate the hand by repetitive motion, and that's what the robots do, then there's a retrograde stimulation that occurs. Somehow, we don't fully understand that something works its way back up the nervous system, back to the brain, and then stimulates the brain to make new connections in that fashion. And then if you actually can combine both the robotic stimulation of the hand as well as electrical stimulation of the brain itself, then potentially you could have a really, robust type of recovery, which we haven't seen before. So the robotic therapies, which we're actively using now, in fact, in preliminary studies, have shown just that. You can take a person who had a stroke even a couple of years ago, reach their point of maximum recovery, and even years later, treat them with the robotic device, and even years later, the person will show improvement above and beyond where they went years earlier. And our investigators have shown that the brain itself shows some evidence of recovery, and it's probably, I think, again, stimulating new nerve cells to grow and develop as a result of the stimulation through the robotic device. So we're very excited about this new therapy. I think it's really just the start of a whole new way of doing rehabilitation, and shows, tremendous promise.
Application in physical therapy. In our specialty, physical therapy is a complement that allows in the improper nerves conduction in muscular and nervous problems. Also, when there is muscle weakness, numbness, cramps, and paralysis of the lower limbs and any muscle. In motor recovery after a stroke. Pros and cons. Pros. At the same time that stimulates the muscle, is allowed to know the state of operation of the branch of the nerve that stimulates. What helps is the diagnosis. Let us know if the cause in the symptoms in muscular nervous. If the electrode is made of tape or a special paste, a merely electrical pulse is delivered. Cons. If a needle electrode is inserted into the muscle, it may cause mild pain of discomfort when the electrode is inserted. The muscle contraction can cause discomfort on some sensitive people. During application, hormones, cramps, or a mild electric shock may occur. Emission applied in Ecuador. The application of this type of technique in Ecuador is preferably carried on the transcutaneously through the electrode. This stimulation has different combinations of frequency and intensity. These are separated by the ascending ramps where the intensity is maximum and descending ramps where no electrical impulse is sent. The intensity is achieved progressively. Note that the contraction and the relation as well. The usual are the frequency values 30 Hz.
In preparation for electrical stimulation, we are going to clean the area for pad application. So I'll use a little alcohol swab, clean the oils and the dead skin off of the region. Up here. For muscle stimulation, we'll apply the pads over the muscle belly parallel to the direction of the fibers. Patrick, what you're going to be feeling is beginning of a tingling. Eventually the muscles will begin to pulse, and what we want is a strong muscle contraction, as strong as you can tolerate. Okay. All right, Patrick, what you're going to start feeling is some tingling as I start the device, and then some gentle muscle contractions, and eventually a very strong muscle contraction. We are going for muscle strengthening here, so we want as strong as a contraction that you can tolerate. It may be a little bit uncomfortable, but it shouldn't be painful. Okay? Okay, Patrick, I'm going to start the unit. You're going to start to feel some tingling. Let me know when you begin to feel that. Our goal is to get your knee straight down to the bottom of the table, to the back of the table.
Start feeling it now.
Okay, so you're beginning to feel some tingling. We're going to keep ramping it up. We want a strong muscle contraction. Okay, so you're beginning to see the muscle contraction there. Is that comfortable for you? Mm-hmm. Can you tolerate more?
You can go ahead.
Okay, and when you feel that, I want you to actually activate your muscle with it.
There.
Okay, right about there. Good. I'm going to start the unit. And it is going to be on for 10 seconds. When it's on, I want you to activate your muscles, and then it'll be off for 50 seconds where you can relax. Perfect. We're going to be doing 10 repetitions of this over the next 10 minutes. Now that the treatment is completed, we'll remove the pads carefully and assess for any adverse reactions of the skin, redness, rashes, any lesions that may have occurred. Overall, everything looks good. How are you feeling?
Good.
Good.
Conclusion. When stimulating current is applied to the electrodes placing on the skin, an extra potential is generated that travels along the axon of the paralyzed muscle, and the muscle contraction and coordinating in the way provides a functionally user contraction. With this treatment induced the need of the hemiplegic patient in the lower extremities after having suffered a stroke Rehabilitation time can be reduced and the patient receives further intervention, which results in lower costs for health systems.